Glad to have you back. Cholera outbreak is currently ravaging some parts of Nigeria, including Lagos, the state known as Center of Excellence. Laboratory investigations and test results confirm that the current outbreak is associated with cholera type known as serovirus or O1. The identified cholera strain is aggressive and highly contagious with a potent variation for widespread, especially with the aid of rainy season. Galaxy News correspondent Lebby Joseph has more in this report. Gastroenteritis, also known as stomach flu, is an infection that causes inflammation in the stomach and intestines. This virus is currently ravenous in many communities across Nigeria. Record shows that over 400 cases of severe gastroenteritis caused by cholera were recorded across local government areas of Lagos State, and many of these cases resulted to death. The Nigerian Center for Disease Control and Prevention recently reported that Nigeria has recorded over 65 confirmed cases of cholera, with more than 30 deaths from 1st of January to date across 96 local governments in 30 states.
When we observe the outbreak, it's a notifiable disease, and the step in epidemiology in cases like this, one, state disease notification officer was alerted, the Kosofe local government M&E was alerted, and we galvanized into action. We threw our facility open to people to come in. Those that we handled. But unfortunately, they brought in about 5 BID cases that brought in dead. Those are the mortality that happened outside the precinct of this hospital. But as for the cases that came in, we did not record any mortality. They all recovered in record time.
At first, we didn't know it was cholera because most of the time patient presents to the hospital with normal symptoms of diarrhea, which is indicative of gastroenteritis. So some other times they could have vomiting as well, and we manage them as the normal gastroenteritis. So up until we take samples and run lab tests, then we're able to know the particular cause of the issue at the time. So when it came in, we had the first case. We thought it was the usual gastroenteritis, but before we know it, we started seeing series of cases, and in about a span of 12 hours, we're able to record several cases. Then we know there's a problem going on.
Cholera disease is caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. Cholera means a global threat to public health and an indicator of inequity and lack of social development. Cholera can cause severe diarrhea and dehydration and can kill within hours if left untreated. Most of the cases in Lagos have been linked to intake of contaminated tiger nut